So here's a story. Make of it what you will. I'm not a doctor. This is only for information purposes. I'm not giving anyone medical advice. The Washington Post reports on April 29th that a growing percentage of Americans dying from COVID-19 are vaccinated. New data underscores that age, even with vaccination, is the massive risk factor for COVID death.
Oh, a massive.
Is a massive risk factor. So, okay. A growing share of the pandemic's victims are vaccinated as COVID-19 deaths grow among the oldest Americans. While many worried the pandemic's toll would shift toward younger people, the opposite actually occurred as the Delta variant subsided and the Omicron surged. So they were afraid that when we got new variants that would go after younger people. It didn't. It actually went after even older people. There was a rise in deaths concentrated among the elderly, who have consistently been among the groups most vulnerable to the virus throughout the pandemic. While the vast majority of seniors are vaccinated, the shot's potency wanes over time, particularly in older age groups. That, according to a story out of this morning's blah, 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 the pair crunched nationwide data from the Centers for Disease Control and Prevention, and here's what they found. Vaccinated people made up 42% of the fatalities when the Omicron variant was surging in January and February. That's compared with September, when vaccinated people comprised just 23% of the deaths during Delta's peak. The bulk of vaccinated deaths were concentrated in people who hadn't gotten boosted. It's still true that the unvaccinated people are at a much higher risk of dying from the infection. But the new data underscores the risks vulnerable Americans face when infections are at a high level in a community and the significant protection booster shots offer. Ready? So here's this chart. Unvaccinated still die at a much higher rate. The share of deaths among vaccinated people has risen, but the rate of death is still many times higher among unvaccinated people. In January and February, unvaccinated people died at about 7 times the rate of fully vaccinated and 20 times the rate. I don't like when they use that 20 and 10 times. That's a deceitful number. When they tell you that instead, why don't they give me the raw data? What percentage of people died?
Is that what it says down there by your arm? It's like 0.2%, 0.4, 3.4. Is that what that means, those numbers?
So, yeah. So 0.04% to 0.34%. That's right. So the fully vaccinated died at 0.4%, and the unvaccinated, according to this, were 3.4%. So that's an increase of about 3%. But they like to say 20 times. They like to do it that way. It's a 3% increase in death. 20 times. It sounds unbelievable. It sounds like 20,000% when they say 20 times, doesn't it? That's what it sounds like. 20 times. So that's at least 100% times 10. No, it's 3%. Experts said they're not particularly surprised. So that means, anyway, experts said they're not particularly surprised that, and I don't even know, I would like to know, again, trying to get the actual death rate for COVID is impossible as far as I can find. We've looked at this before and we can't find it. So are these people who died of COVID or with COVID? I don't know. I don't know who that 3.4% is. Did they die from COVID or with COVID? We don't know. Experts said they're not particularly surprised that vaccinated seniors are comprising a greater share of fatalities. As Fennett and Dan explained, the more people infected with the virus, the more people it will kill. That makes sense. I can follow that. And that includes a higher number of those who are vaccinated, but are also among the most vulnerable based on age or health conditions. Overall, deaths among seniors have increased in recent months. Nearly 2/3 of the people who died during the Omicron wave, 75 or older, compared with 1/3 during the Delta surge. So here, oldest seniors are again the majority of COVID-19 deaths. So the red line are age 75 and older. So that's who's dying. Here's age 50 to 74. There's a big gap there. Okay. So, and you see how it's going old. So it's younger people, it's going down. Older people, it's going up. What's this line? Under age 50. Look at that. This is under age 50. It's almost non-existent, the deaths from that. So what I'm getting from this, I don't know what you get, but what I get from this when I read it is that this is something that's affecting old people. And that the greatest risk for COVID death is your age. And we know already that the average age for death from COVID is over the age of life expectancy.
What is it?
It was 82, I'm pretty sure. What?
Really? Oh.
Mm-hmm. Let's look that up. The average age of death from COVID, I'm pretty sure it was 82. The rising number of vaccinated people dying should be a cause for alarm, experts say. Though the shots aren't foolproof, the vast majority of people survive infections. And did you know that half the country got Omicron? Do you know half of the country in the United States got Omicron last winter? Did you know that? Did the hospitals get overrun? No. It's still absolutely more dangerous to be unvaccinated than vaccinated, Andrew Neumer, a public health professor at the University of California at Irvine who studies COVID-19 mortality, told Fennett and Dan. A pandemic of and by the unvaccinated is not correct. And that was just propaganda to get more profits into big pharma. People still need to, not one comedian that I see push back on that. Nobody pushed back on that. Anybody push back on that when the people were saying it's a pandemic of the unvaccinated? You see any comedians get on stage and say that's bullshit? I didn't see any. I did. I said that's bullshit. You see anybody else? No. Fucking gutless, spineless lemmings. People still need to take care in terms of prevention and action if they become symptomatic. So there you go. You make of what you want of those statistics. But the next time you hear them say 25 times, 30 times greater, it's usually very small percentages. Anything you'd like to say about this, Kurt?
Well, that's what I've been saying. We need to solve this in Roe v. Wade by making a vaccine that causes abortions.
And I would like to know my comedian friends who wag their finger at me for speaking my truth about my lived experience with the vaccines. I would like to know if they're taking the fourth booster. Why not? Fauci says you should. You're not going to take the fourth one? What about a fifth one? No? At what point do you start getting to think for yourself too? When do you come along to being as grown up of a person as that pothead idiot Jimmy Dore?
I think when you crack your head on stage live while you're bragging about your vaccinations.
Yeah. It took one comedian to pass out live on stage and crack her head and get a concussion for her to say, you know what, I don't think I'm going to get that fourth booster. It's good to see, it was sad to see that 99% of my comedian friends repeating propaganda and attacking me without even a conversation about it. Right? You want something to say? You got something to say to me, a guy who's fucking vaccine injured? You got something to say to me about the vaccine? Why don't you fucking say it to me? Because again, they don't know the science. They're wrong, and they found their fear point. There's nothing sadder than a skeptical comedian who is wedded to their fear point over
You're
COVID.
not seeing the big picture here, Jimmy. We have to do this to help Democrats because we need to protect abortion. You're going to lose the war with your battles.
That's right. That's right. You got to shut up and vote harder. Vote blue harder. Okay, so there you go. Make of what you want with that. We're doing live stand-up shows in Cleveland, Columbus, Pittsburgh, Des Moines, Omaha, Kansas City, Las Vegas, all over the country. Go to jimmydorecomedy.com for a link for tickets. And single tickets now available at all venues. So if you tried to buy one before and you couldn't, single tickets are now available. Plus, while you're at jimmydorecomedy.com, why don't you become a premium member? Sign up to our mailing list so when they cancel us, we can still stay in touch.